Welcome again, everyone. Thank you so much for joining us. We have a very exciting program planned for you here where we'll dive into two phenomenal projects. Before I get started, I want to pause and ask you for your engagement. Please introduce yourself in the chat box. Tell us who you are and where you're joining us from. Make sure you send the messages to both the panelists and the attendees and take this time to engage with each other. Our two speakers today, Free Asanga, COO of Nkafu Policy Institute Cameroon, and Bruce Vaillant. I hope I'm pronouncing that correctly. The French speakers among us might chastise me for this one, but Bruce Vaillant, I assume that's how it's pronounced, is Program Manager of Center for Development and Enterprises, Great Lakes, Burundi. And they're going to tell us about how they have pivoted their work in the last few months to address their community's most pressing concerns. So COVID-19 has shaken our world. All of us are in this boat together across the globe. I think it's the first time that we are all experiencing such a phenomenon in our lifetime. Myself, I'm joining this program today from Nairobi, Kenya. And in Kenya, I have been in quarantine for the last 12 weeks, I think now. I'm even forgetting how to socialize with people physically. I met a friend recently and was quite nervous. We didn't know what to do with each other. We were sitting outdoors in a restaurant, very far from each other, but I couldn't sit down. For the first 30 minutes, I was standing away from her and wearing my mask. And at some point she said, I know, June, that you're nervous. You haven't been out of your house for this long. So feel free to sit down when you feel comfortable. But it's been a fundamental change in how we live and how we do everything. One of the key things that we are still looking out for is to see what the impact of COVID, the second and third order effects of COVID will be on the economies and on our lifestyles in general. I run a company in wastewater management. So we serve the construction industry, people who are building residential or commercial buildings that are not connected to the municipal sewer system. We supply them with packaged wastewater treatment plants that they install in their buildings so that they don't have to deal with their wastewater haphazardly. In our industry, we don't see a clear line to revenue at the moment because we don't know how COVID is going to impact developers. Everybody's hanging on to their money. A lot of projects have been canceled. Up to 75% of existing projects have come to a halt. You can imagine what the knock-on effects of that are on the steel industry, on all construction materials in general, and all the businesses, small and medium-sized businesses that have been affected as a result. So we, in my company, for example, had to think very quickly, what is it that we can do in order to make sure that we diversify our revenues, and we're essentially becoming a software company to help buildings manage their wastewater, existing buildings, and so building a software platform for that, etc. So what our presenters today will share with us is how in their policy advocacy space they're thinking about these kind of pivoting that everybody is having to think about across various industries. So to address some of these challenges, Free has launched the COVID-19 task force in Cameroon, responding to a pandemic while protecting individual liberties in Cameroon. And Bruce has a Kanguka campaign in Burundi, which means wake up or even Amka in Kiswahili. Amka is Kiswahili for wake up. If you have any questions or thoughts, please enter them into the chat box. We'll incorporate them into the discussion. So we'll go right ahead and start with Free. Free, perhaps you can start us off since your project addresses some of the pretty big issues around how Cameroon should respond to COVID-19. I'll give the floor now to Free. Free, welcome very much. Thank you very much for joining us today. Hello, Free, can you hear me?
Yes. And thank you, everybody. Welcome and greetings from Cameroon. Now, I'd like to take you through what we have done so far in our project. And like you have heard been introduced, the project is responding to the COVID-19 pandemic while protecting individual liberties. So in Cameroon, just to give you a brief background, the first case was reported on the 6th of March, 2020. And a little after that, the government put in place some measures to curb the spread of this virus. We continue to see an increase in the number of cases in Cameroon. And for that reason, the government went ahead now to put in place by the end of April some measures, some relief measures to mitigate the shocks of the preventive measures that have been put in place. That notwithstanding, in Cameroon, the number of cases is still on the rise. The reason why, week after the government announced the first case in Cameroon, at Nkafu Policy Institute, we became proactive and decided to take measures of our own to put in place a Corona task force. And the reason for this task force was because we're learning from the experiences of what has been happening in other countries, and we knew that if things are not done correctly, we're going to get there to the situation of what at that time was a very devastating situation, for example, in Italy. So if we have a general look at the background in Africa, the Central African sub-region is the least affected by the COVID-19 pandemic.
Free, I apologize to interrupt. I believe you're having some internet issues. And so to help with that, Free, if you're able to hear me, we're going to pause, and I have your presentation here. I can share it from my screen, and that should help you with your internet. So let's see if that assists. One moment, and I will pull up your presentation. All right, and so Free, can you hear me?
Sorry for the hitch. I think I was correct.
Okay. Free, we may pause and we may try.
Back online?
Unfortunately, it's very spotty. We may pause. Maybe we move to Bruce's presentation, and then what we will do is we'll work with you on a backup plan to get your audio to come through clearly so that you can continue your presentation.
Okay.
Okay, sorry about that, Free, but we will get to you. We'll work on this. So June and Bruce, I apologize. Bruce, would you like to give your presentation, and then we'll go back to Free as we work out her internet?
Sure, of course.
Thank you.
Hello, Africa. I'm pleased to share with you what we have been doing during this pandemic situation in Burundi at CDE Great Lakes. So my name is Bruce Vaillant, and I'm project manager at CDE Great Lakes. In Burundi, we have launched a project called Kanguka, which means in English, wake up. And maybe before I talk about the project, I should start talking about why we chose that name, wake up, in this situation. So when we started to have new cases of COVID-19 in Burundi, as may have been the situation in other countries, we started hearing some restrictions from the government. Like the first one was to closing the airport. We only have one airport here in Burundi. Closing all the borders of Burundi from Tanzania, DRC, and Rwanda. But also there was many restrictions for private sector hospitals who couldn't have the right to treat the patient from COVID-19. So there we started asking ourselves why, when the airport was closed, the first persons who was targeted was the persons from Dubai, which is the first area where many goods of Burundi are imported from. And we asked ourselves also why all the drivers of trucks of goods were the one targeted, telling us that there was the one spreading the virus in the country. And the third question we had was how the private sector hospitals was pointed to be the ones telling the population that there is many virus of COVID-19 here in Burundi. So what we saw was that many people in Burundi was gaining more fear and losing hope. And we saw that when people lose hope, it is like they give a red carpet to the government to bring more restrictions. So from that point, we saw that we need to do something. As a think tank, as thinkers in the Great Lakes regions, we need to do something. But when we started to enter in contact with our different partners, because as we work in a very hard environment, we can do things ourselves. We have to work with different partners. But what was even more difficult is that our different partners was in a situation where they couldn't even speak to us about this situation of COVID-19. And guess why? It was because mostly they had fear about the restrictions of the government. So as we work with the different members of the parliament in Burundi, of regulatory agencies, we tried to search for information and try to know what was being doing by the government to come against the COVID-19 pandemic situations. And all the information we got was that it was a very uncertain situation and fear situation even in the government. So then we knew that we were in a very, very dark situation. And all the efforts we have been doing to raise the freedom and liberty for trade here in Burundi was going to be destroyed. So it was very hard to come up and speak about this situation because there was many restrictions, but we said we can't just let this situation continue like this. So we decided to come up and start speaking to see what will be the reactions of the other partners who couldn't speak about this. So we only launched our project. We didn't know how it would work very well. It was not very clear also for us. But when we launched our project, we started to hear some partners of our organization coming and asking, what do you think about this situation? We don't really know what we can do. So there was no clear ideas from other people. So that's where when we started some activities, direct discussions with different partners, gathering some informations, and then we ran a very important event where we called many parliament members, many civil society organizations here, and we started telling them, at least even though we can't do much, but at least what we can get from this situation is to have the right to speak about this and talk and getting new ideas, and don't let only few politicians, people decide on what our future should be from this situation. So that's where we get some ideas from different people, from different partners, and we come out with a very strong strategy to work on as a CG Great Lakes in this situation. So we saw that all these strategies we have to do with the Wake Up campaign would help us to reinforce, to run again all the efforts we was doing. So the objective of our campaign now is to have a long-term public health policy reforms here in Burundi. So we are targeting 3 or 2 main reforms, because as maybe some people may know, in Burundi we have 0.6 doctor who take care of 10,000 inhabitants, Burundians here. So we say that it's not only a pandemic COVID-19 issue, it's all about the policy of health, how it is organized here in Burundi. So we want to have reforms to have more private sector people engaged in the health system. And for this, we are targeting to have many activities like direct discussions with different people, policy brief on main issues regarding these pandemic situations. And also we have started a strong media campaign, and we hopefully will launch also a national petition to encourage human dignity here in Burundi in this situation of COVID-19. So for us, we think that even having the chance to talk about the situation, having the chance to bring out small entrepreneurs, to give them the chance to speak about this situation is a big change for us, for dignity and for liberty here in Burundi. And we have already got some good results with these projects, because first of all, as I said, we had the right to talk about this situation in media and public. That was a very hard thing at the beginning of the situation. And secondly, now the borders of Burundi are opened for trucks, transporters who are carrying goods from Tanzania and from Rwanda. That's a very important thing. And also now, the private sector hospitals have the right to test and to treat people affected with COVID-19. And also, I can share with you that there is a very small committee of 5 ministers here in Burundi who is in charge of the response for COVID-19. We had the chance to have one of our small entrepreneurs being called in that very small and closed panel to share what small entrepreneurs think about this pandemic situation and what should be their interest to continue running their businesses. So we are looking so far to bring more impact with this, because we believe without this campaign, our liberty efforts can't take along here in the situation of Burundi. Thank you.
Thank you very much, Bruce. Thank you. Congratulations on your initiative and for taking the bull by the horns and jumping in. My sincere condolences for the loss of your president. I think that that is one of the things that has made people really wake up in Kenya as well, when they realize that we are not immune, because the numbers have been quite low in Africa in general. But that actually is what drew my attention to the situation in Burundi, to see what the kind of strategy was being used in Burundi in terms of prevention and some of the policies the government had in place. We also have your first lady was flown to Kenya, and I think she's still in hospital with COVID right here in Nairobi. So we've been quite alive to what's going on the ground in Burundi. We have a few questions that have come in, and one of them is directly to you, Bruce. The question is, how do you assess the response of the Burundian government to this health crisis? According to media reports, the government downplayed the scope of the pandemic and, for example, kept sports events and so on still going on. And what somebody has asked this question would like to know, what is your assessment of how this whole situation was handled?
Yeah, thank you. So as I said in my presentations, when we started having some information about this situation, what we saw was that even in the government, there was no real plan to respond on this situation. And the only plan was to let people in the ignorance about how the pandemic is spreading, to make sure that the government can continue doing his work like there was nothing. So I think that how this situation was managed, it was a very bad organization. It was a very bad organization, and but we believe that at least with what we got from borders being opened, with the private sector hospitals getting the chance to continue working, we hope that maybe it will be better in the near future. But the situation was very, very hard.
Thank you very much, Bruce. So our takeaway from Bruce's presentation is that our work has to be relevant to the times. And what I'm hearing is that Bruce was and his organization were there looking at basically a situation going out of hand, and they decided to pivot and begin to address the current situation in Burundi, mobilizing various stakeholders to have a conversation at a time at which the government seemed to be either paralyzed or didn't have the initiative. Thank you very much, Bruce. That was very inspiring. We wish you all the best with your work, and please reach out through the Atlas Network if you need any support. In Kenya, for example, we have a lot of people doing modeling and big data analysis and things like that that might be helpful. But anyway, there's a bunch of resources, and maybe other people who are attending will also be able to share with you in what ways they can be supportive. We will now try to get back to Free's presentation. Free, are you there?
Yes, I am, June.
Okay, please take it away.
Okay, thank you. And welcome once more. Greetings from Cameroon. So our project is responding to the COVID-19 pandemic while protecting individual liberties. So to give a brief background of the situation, in Cameroon, we had the first case of COVID-19 reported on the 6th of March. And close to 2 weeks later, we had recorded the first death from the COVID-19. But before then, the Nkafu Policy Institute, we decided to be proactive because learning from the experiences of what was happening in Europe and in America, we knew that if nothing is done, we are going to get to that kind of a devastating situation. So the first move we made was to close down the office and started working remotely. We also, at the Nkafu Policy Institute, decided to put in place the coronavirus task force. This task force is at the center of our project because we use this as a platform to get on board people who are encouraged and who are motivated to address the issue of the pandemic. Now, just to give a brief background, right now Cameroon has crossed the 10,000 mark of confirmed cases, but although the Central Africa sub-region has the lowest number of cases, Cameroon accounts for about half of the cases. Reason why it is very important for us to address the issues of COVID-19 in Cameroon so that we can contain the spread of this virus, not only within the country, but also within the sub-region and on the continent at large. Now, the project is designed actually to address three main issues. As I've earlier mentioned, the government has put in place preventive measures and as well measures to curb the economic impact. But the question is, what is the civil society doing? How are entrepreneurs responding to this pandemic? So with this project, we're trying to address this issue and also to try to propose policies that the government can put in place and which will minimize the shock of the pandemic, especially to the vulnerable groups, mostly the informal sector, in a country where we don't have safety nets for such populations. So to do so, we have thought of addressing widespread education and sensitization to make sure that all and sundry are aware of what is happening, the consequences of this pandemic, the preventive measures, and also how to deal with day-to-day life during the pandemic. For us to propose policies, we need to evaluate the actions that have been taken so far, both by the government as well as other actors. So we are also engaged in using data to propose policies that will minimize the consequences of this pandemic, as well as also promote free enterprise while protecting fundamental rights. Now, for us to achieve these objectives, we outline a number of activities. These are not exclusive activities, but we are engaging the public in webinars and interviews, bringing experts on the field from Cameroon, from Africa, and the world at large to come and share their experiences and engage the public on how to address the pertinent issues that are arising from the pandemic. We also have at the Corona Task Force experts who are engaged in research, and the results of this research are published in as policy papers addressing these pertinent issues. After publication of these papers, we then now organize seminars and online seminars to address and let the public discuss on the pertinent issues that have been raised. To do so, we are also beefing up the Corona Task Force at the Nkafu Policy Institute by appointing research fellows and also engaging those who are very much interested in the work we are doing. So far at the task force, we have over close to 50 volunteers who are now working with us to attain this objective. We know that in Cameroon, the government has acknowledged the fact that communities must be engaged in their future, and we're moving towards decentralization. Reason why with our project, we're also engaging community leaders in preventing the spread of COVID-19. So we had a project, a pilot project that we started with one community, and we're hoping to replicate that with other communities so that the communities themselves will be engaged in everything concerning the COVID-19, take proper action for prevention, and also to identify symptomatic cases in their area. In Cameroon, there's a lot of myth that goes around the COVID-19, and in a situation where some part of the population has lost faith in the government, you need them to listen to people with whom they have confidence. Reason why we're engaging the community in this strive to fight against the COVID-19 pandemic. So to move on, like I've explained, we've done a number of things. There's lots of things that need to be done, but with the assistance of our colleagues, friends, well-wishers, and the government, we are hoping to move, as well as Atlas Network, we're hoping to move this strive forward. Why does it matter to us? The reason we are really engaged in the COVID-19 fight head-on is because despite the measures put in place by the government, the number of cases in Cameroon is still rising, and we are yet to level the curve. There is also a lot of myth that surrounds this. And if people are not educated massively, then the spread is going to continue because a large number of population does not believe in it. They've lost faith in the government. The measures put in place do not take into consideration the realities on the field. Cameroon is plagued with conflicts in the north, the Boko Haram conflicts, in the west, the Anglophone crisis, in the east, the refugee crisis. And with all of that, some of the measures put in place actually need to be contextualized. Reason why we believe that the work we're doing will be fruitful if we take it down to the community level. Also, there's a lot of changes that have been taken place because of this COVID-19. We all agree that the world is not going to be the same post-COVID-19. Now the question is, are we prepared for that? So at the Nkafu Policy Institute, we have taken upon this to bring together experts so that we can discuss what happens after COVID-19, what are the measures that will be put in place in order for us to get back to normal, for businesses to operate and prepare for other shocks in the future. So with this, we're hoping that we're going to engage the Cameroonian public. We've been doing that. We hope to engage many more people in these discussions because most of, especially the man on the street, does not have a platform to discuss these issues. So by creating the coronavirus task force, we're hoping that we're providing a platform for more people to discuss on the issues that affect their daily lives. We're also hoping that by bringing policymakers together and presenting them with some of the policy prescriptions that our researchers are coming up with, we can have the policymakers make decisions that will actually positively influence the population in Cameroon. So thank you very much. And you can all visit our website, thecafu.org/coronavirus, to see the work that we have been doing so far and to give us feedback with positive so we can improve the work that we are doing in Cameroon. Thank you very much.
Thank you very much, Free. I hope everybody will take the invite from Free seriously to visit the website and to chime in, to check what they're doing and to chime in and give recommendations, etc. I'd just like to, before going back to the questions from the participants, just wanted to mention that I have been part of numerous webinars, etc., around COVID, mostly being run by professional associations in amongst our stakeholders. Like I mentioned, we serve the construction industry in Kenya. So the number of professionals is many. You have architects, you have engineers, you have quantity surveyors, you have contractors, you have developers, and each of these groups have their own professional organizations. These are people who have their pulse on what's actually happening in their industry. And in such forums, it's quite easy to collect data to get a quick understanding of what's really happening, because we are all at home, but it's important to proceed on clear information that is accurate. My question is, are you guys, are you participating or tapping into such professional and industry associations where you have people with a lot of skin in the game in terms of running businesses and so on, and so that the data that you're gathering is very helpful? Because it's one thing to go to policymakers and have all policymakers in a room, but it's another thing to go to policymakers with actual data from surveys that you can run after a webinar amongst or surveys that are run by these professional associations, etc. How are you gathering data is the question.
Okay, thank you, June. Like I mentioned, we, amongst the Coronavirus Task Force volunteers, we have a group of researchers. This group of researchers are in charge of that aspect of data collection, analyzing the data, both national and international data. So this aspect is taken care of, and that's why we encourage the experts. In that group, we have experts in all fields. We have economists, sociologists, anthropologists, because we know that in order to get policies, there must be informed policies backed by actual data, both secondary and primary data that the research arm is collecting. So actually that has been taken care of. I would say that we participate in other webinars organized by institutions, and we also invite those experts to our webinars to come and talk to our own audience. So that way we get a global perspective of what is going on around and how others are addressing the COVID-19 pandemic in their various countries.
Great, thank you very much. My last question before I go to the Q&A from the participants is, in terms of collaboration, what we are seeing in Kenya is very rapid acceleration in collaboration between groups of people who would previously not probably be talking to each other as much, but we're now seeing people taking advantage of these fora because everybody is trying to figure out how to survive, how to pivot, how to do the somersaults you need to do, what are the trends, etc. And the amount of openness to receiving of ideas and sharing of ideas is unprecedented. I consider Kenya a very low trust environment in general, but for the first time we're seeing quite a lot of openness. You don't have to wait in line to go meet some government official for this or the other. They're open, they're willing to, they themselves are setting up forums online for various stakeholders to come and speak and share ideas. And they're taking up these ideas very quickly and implementing them. Are you seeing this kind of acceleration in collaboration? Because I really think that it's going to be the saving grace. We're seeing a lot of innovation happening during this COVID time on the Kenya scene. In Burundi, in Cameroon, are you seeing this kind of accelerated collaboration and innovation?
So I think that in Burundi, the collaboration is very hard currently. So even before this situation, the collaboration was very hard because it's not easy to collaborate. People don't like to share information here. But at CDE, the chance that we had is that we had a very strong ecosystem mapping of the different key players which can engage with what we are doing. So this helps us to come and try to find what are their interests and trying to get what we want, but by engaging them also with their own interests. And it's currently harder to go and meet officials and other actors, but with CD Great Lakes, at least we have that chance to have a strong connection with the key players in what we are doing here, but it's not really easy. There's not that kind of acceleration here.
What about with other think tanks around the world, other free market think tanks? Are you getting an opportunity to have these conversations?
Yeah, of course, sure. This is maybe what even helped us when we was discussing with others. This what helped us to come up and say, listen, even if the situation is not clear for us, we have to start and launch these projects, even though we knew the consequences would maybe be hard. Maybe I should directly ask to comment from Linda Kavuka in the chat box, which is related to this. She asked how we persuade the government to open up discussions. I think that it wasn't really easy to open up for discussions. As we said, even our partners didn't want really to engage in discussions on this issue of COVID-19 and the economy of Burundi. So what we did was really to launch first the project with anyone, although we knew the consequences would be hard for us. We launched the project. We started direct discussions with some people, and we started running our media campaign. And it's after that we started getting feedbacks of people, even in the government, asking, what do you think about this situation? Do you have some solutions? We said, no, we don't have great solutions for now, but the first thing is to open and discuss for this. And that's how we had the first conference discussing about COVID-19 and the consequences on the Burundian economy. And that's where the starting point for us to discuss on this issue with the government and other actors in Burundi.
One last question for Bruce. Question from the participants: have you been able to look into the cost and market share of privately owned health facilities, and why government should, to some extent, ease occupational license in the health sector during this pandemic? Sorry, we can't hear you, Bruce.
Currently, I can say that we don't really have those data shared, but what you know, in Burundi, the health sector has been very regulated. We don't really have many private sector strong hospitals. We only have like 5 hospitals only in Bujumbura. Like I said, in Burundi, we have 0.6 doctor for 10,000 inhabitants in Burundi. So you can understand that the contribution of the private sector is still very needed. But what we saw with this situation is that even for those hospitals in the private sector, there was the first ones to be targeted by the restrictions of the government during this period. So we think that as we are trying to work on this, We plan to have a policy brief on this situation, and maybe we'll have more data on this. Thank you.
Thank you very much. Free, would you like to take up the question that has been given? This will be our last question. Who heads the COVID-19 task force in Cameroon? Does the government intervene in this case in the case of COVID in Cameroon? I'm not sure I understand the question, but maybe the first part I understand. Who heads the COVID task force in Cameroon?
Okay, thank you, June. I would like to emphasize here that the COVID task force I am talking about is the COVID task force put in place by the Nkafu Policy Institute. The government of Cameroon is doing a lot with regards to fighting the pandemic. It has a lot of actions that it has put in place, but we of the civil society understood from the onset that this fight is not a fight that we can leave in the hands of the government alone. Reason why we put in place a task force at the Nkafu Policy Institute. At the Nkafu Policy Institute, our task force is headed by our division, the senior analyst for health policy in Nkafu Policy Institute. And we have staff that are involved in the task force as well as volunteers who come from all walks of life, from both the health, the economics and all sector, coming together to reflect on the issues affecting Cameroon as a whole.
There's a follow-up question for you, Free, which is you have the word they've used is force, but I think what they mean is you have responded very strongly to fighting COVID-19. Do you think of using this same kind of strong commitment to fighting an issue like Boko Haram, or is Boko Haram not as serious as the virus?
Thank you for that question. I think Boko Haram, just like all the other crises in the country, are very serious. And the government is handling some of those. But looking at the community contribution towards the fight of this crisis, I would say that with Boko Haram, much of the success of the government also comes from actions taken by the community, because communities in the north have vigilante groups that are alerting the government when they have suspicious cases. So in every crisis, be it Boko Haram, be it the Anglophone crisis, be it the refugee crisis, the government has a role to play, but the community, the civil society also has a role to assist the government to achieve the objectives that it has set for. It is through this that the Nkafu Policy Institute has decided to play its own role in assisting the government to cut the surge of the COVID-19 pandemic. Thank you.
Thank you very much, Free. I think that's all we have time for today. This sounds like a conversation that needs to be ongoing. Sounds like we need maybe I'm just the only one who's not been part of it, but a kind of free market think tanks and freedom lovers forum that meets maybe even once a week or once every 2 weeks to share experiences in our various countries. In Kenya, people are talking about their right to trade. When Free mentioned contextualization of response, we are in countries where the government can't write a check to everybody who has to stay at home, and many people earn daily wages. So if they stay at home, they can't make a living. And of course, there's the coming economy, which I think for a long time, we're going to be feeling very deep economic impact of COVID-19. And how do we think through what kind of economic policies we should be having in place, etc. I'd like to thank Atlas Network very much for organizing this forum, and welcome you all to continue this conversation variously after this. The next session will begin at 1:15 p.m. Ghana time. Join us for an engaging conversation between Big Daddy Liberty and Magat Wad, Director of Atlas Network Center for African Prosperity, on the ideas of entrepreneurship and action as a hopeful message to Africa. Thank you very much, everyone. Enjoy the rest of the
Thank
seminar.
you.
Thank you. Bye.
Thank you, June.
Thank you too.
Thank you. Thank you to our participants. Thank you to our panelists.